Hey ladies, welcome to 2 Peas, 1 Pod 318. 2 women, 1 friendship. We're your hosts, Felecia and Benet, 2 Louisiana women from different sides of the track who have experienced many of the same life challenges and now sharing with you. We want to let you know you're not alone. Grab a cup of coffee, wine, even sweet tea. Sit down with us, relax, sit back, laugh, and have a little fun. Felecia and Benet, let's talk life challenges for women over 50. Welcome to 2 Peas, 1 Pod 318. We are starting our new year off right. We've got some great topics for you. We're so excited to be back. I am Felecia, and this is
Benet.
And we have a very special guest to discuss a topic that I think is going to keep everybody wet for the new year. How about that? I'll let you introduce our
I'm
guest.
going to do the introductions, and ladies, we haven't formalized the topic for this, but we're going to be talking about the pink parts. Yeah, we're going down there. So, with our special guest today, we have Dr. Busada, who is with Ochsner LSU right here in Shreveport, Louisiana. And I have to use my cheat sheet because she's so phenomenal with her background. She is a graduate of the University of Texas at Austin, and she got her medical doctorate degree from here, right here in Shreveport at LSU. Her areas of expertise include minimally invasive and vaginal gynecologic surgery, high risk and general prenatal care, wellness and annual screenings, uterines, as well as menopause and premenopausal or perimenopausal management. But we're going to be talking about postmenopausal today. So I've given her a list of questions, and I have these questions here. So we're going to start talking about the different answers for these topics. Okay. Just give us a general overview of changes in a woman's body postmenopausal.
Okay, sounds good. Well, first, for starters, thank you guys so much for having
Absolutely.
me. I've known Benet for years, and I'm so happy to be here, and looking forward to being with you guys.
Yay.
As far as changes go, whenever that menopause transition starts happening, that's when the symptoms start manifesting. Hot flashes, night sweats, increased brain fog, fatigue, possibly mood changes, vaginal dryness, atrophy, that kind of whole spectrum, weight changes. So it can really be a distressing time in people's lives whenever all of this is occurring. And sometimes it comes in slow and subtle, and sometimes it comes raging in fast.
And there's no specific age it starts at, because I've known
No.
women in their 30s to start premenopausal. I know women in their 50s and 60s that are still going through
That's exactly right.
perimenopausal.
That's exactly right.
I'm
It
beyond
is-
that now. I don't have any of those issues anymore.
Gotcha. Oh, gotcha.
Let me disagree with you. I thought I was finished. We're starting all over again.
Oh,
I
goodness.
started it in my 40s.
Okay.
And I just kept saying I wasn't. I was in denial.
Gotcha.
And then I leveled off. And then I've noticed in the last few months, I've started to have a few little night sweats. I've kind of been swimming in the pool when I wake up in the morning. A few hot flashes are coming back. But my biggest thing is, once again, our viewers know I have been the celibate one for the last 7 or 8 years. And I tried to decide to dip back into that pool of sex.
Okay.
And let me say, she is not the same at 53 that she was at 40 or so.
Sure.
So with that being said, we could not do that task. It was very painful, very uncomfortable. So I want to talk about sex after 50. I'm that P. She's the other P.
And let's bring this in, because this was one of the questions I gave her. When does estrogen or hormonal therapy even come into play in a woman's life? What are the indications you do that, just for health reasons, but also for sexual aspects of it?
That's a really good question. And it's one that actually the medical community is playing catch up in. So whenever I was in medical school, the Women's Health Initiative, which was a big landmark trial, they did studies on women receiving hormone therapy, and they proposed that being on hormone therapy will you know, provide a lot of cardioprotective benefits during that time period. Well, the average age of the patient in that trial was in their early to mid 70s.
Oh, wow.
So these were women who had gone over 20 plus years receiving no hormones, then got loaded with a bunch of systemic hormones, and they ended up having to close the trial early because of reports of heart attacks, strokes, etc. Wow. So in the medical community, after that big trial happened, it was, pendulum swung so far backwards of don't prescribe hormones, hormones are bad, you know, they cause all of these issues. And we had, an entire generation of women that suffered in that time period.
Wow.
Because it was the wrong type of patient that was selected for the study. And so all during that time, you know, women were having to go through menopause with not much support. And since that time, we've adjusted our thinking. They've now done additional trials on women instead of starting hormones that far late in their lifespan. They said, okay, well, what if we gave hormone therapy when the transition was occurring, you know, in that perimenopause or early menopause phase, and the results have been remarkable.
Is it pill, shots, cream, vaginal inserts? Is there a predominant one over the others?
All of the above.
Okay.
Now, the safety profile, the topicals and the patches have a much lower risk profile than the systemic hormones. But some women, if their symptoms are bad enough and they don't have risk factors, systemic hormones are great too.
And does some of this help with vaginal dryness? Which
Yes.
rounds us back to that.
Yes.
Okay.
Yes. With the hormones, not only that, but such better life expectancy, a 19% reduction in all-cause mortality, dying of any cause. And so it's interesting because for years in the medical community, when we weren't actively practicing hormone therapy, now the pendulum has swung so far. Hormones are so back. And it's good. It's such
It's probably more refined than it used to be.
Exactly. It's
Okay.
much better quality of life, much better benefits for bone health, cardiovascular health, even just overall quality of life when you're at home with your family and at work and everything else. And so as far as which one is best, it really just all depends.
Sure,
It's
sure.
kind of similar to the birth control phase. When people are going and taking all these different birth controls, some work better than some. It's all individualized based on what works for the patient. And so as far as which ones to prescribe, it really is individualized based on the severity of symptoms and the risk factors. But kind of swinging back into that sexual health, vaginal estrogen is one of the safest ones that we can do. Because it's a topical cream and isn't systemically absorbed like the pills, it does so much benefits for vaginal dryness, sexual health. It can really help with pain.
Yes.
Just beefing up those tissues and having less dryness and atrophy, it
Okay.
can certainly help with that. And vaginal estrogen has like a 30% reduction of mortality and other things in comparison to nothing at all. So, I mean, it's a really, really safe one.
And it's
to
something you have to do
implement.
consistently is what I'm
Yes.
understanding.
Mhm.
Okay.
Yes. Now, of course, if symptoms are a little bit better and people say, okay, the cream is, you know, messy and other things, you could try to start tapering off. But if those symptoms come back, taper it back up again. You know.
Sure.
Other hormones, you know, the patch is another really, really good one. As far as the safety profile, it's a little bit of a lower dose in
I
comparison to
tried
the
a patch in my
orals.
40s and I cried all the time. I said, this is not
Did
me. And I
you?
stopped it.
Yeah.
I couldn't do it.
Yeah.
Yeah.
Did you do any of the creams?
Not until within the last year or so.
Gotcha.
Yeah, because of the changes, the
Yeah.
biological changes and other factors. What's a percentage of your clientele that's over 50 and they're actually very honest with you about their relationships with their husband, or there's a new relationship in their life, or do you think they're pretty open and candid about it?
That's a really great question, and I think it depends. Ultimately, I see a lot of patients too with other GYN complaints. Whether it be abnormal bleeding, fibroids, pelvic pain. So that is a really significant part of my practice too. But even during that time period, if you're having perimenopausal breakthrough bleeding, pain with intercourse, things like that, it kind of can all tie in hand. But as far as, it could be a really difficult time for a patient to have to admit, I'm having trouble in my relationship and my libido is really down and sex hurts now, and having to kind of navigate some of that together. And
It's psychological and biological
Right,
in many
right.
cases, sure.
well, and going back to testosterone therapy, the main thing that has been shown to statistically improve with testosterone is libido. So anyone who's struggling with low libido and doesn't have significant risk factors, it's a good.
I had a friend do it for better muscle tone in their bodies.
Really? Okay.
Yeah, because she said,
Yeah.
I'm turning flabby everywhere.
And
I
it-
said, well, our bodies change after 40 years old.
Sure. And in certain regards, we're still, playing catch up with the data. But just on like an anecdotal individual basis, the hormones have really been shown to be helpful.
That's great.
So,
Do you find that women are still in denial when it comes to menopause, realizing or stating that they're going through it? Because I know for me, I started in my 40s.
Sure.
And I wasn't really sure that's what it was. And my sister's about 4 years older than me, and she told me that she hadn't.
Right.
And so I was like, well, clearly, if you hadn't and you're 4 years older than me, then I haven't either.
Sure.
But I really had.
Yeah.
And I think because I wasn't honest with my physician, and I wasn't honest with myself, it was years later.
I think with us as women, it's so easy to put ourselves on the back burner just consistently. Where if some of these symptoms are coming up, it's so easy to write it off on, oh, I just must have had a bad night's sleep, or maybe I'm stressed, or maybe, there's a million different things that we can explain away versus, oh no, I need to go and seek help for this because this difficulty
And
sleeping
so
is
many women are
because
caretakers of the world, and
That's
they put themselves
exactly
last,
right.
especially when it comes to health.
That's exactly right.
And
And so it's easy to kind of suppress some of that and say, I'm handling a million different things. And, the quality of sleep is something that, if you're waking up in the middle of the night with night sweats and everything else, and then you're trying to be a functioning person the next day. It's a night and day difference. So,
Can you look at your mother or your grandmother and think about when you're going to begin to go through the process or have these different things occur?
that's a good question. And there is a certain familial component to it. I think about it in the extremes, like if someone's parents went into premature ovarian failure, they may be more likely to also have that transition a little early, and vice versa. Is it like a hard and fast rule? No. But it can, if someone says, well, gosh, I'm in my 50s and I'm still having periods, but, come to think about it, my mom finally stopped at age 62, and it's like, well, that very well could be the case here also, That's a really good question.
Can you tell people about the options that they have? I know they mentioned pellets and mentioned creams and even natural hormone replacement therapy. It's different than synthetic hormones. So
Sure. You mean for sexual health or just overall?
Just overall.
Overall. It's kind of like you guys alluded to. There are, just so many different things out there. There's creams, gels, patches, pellets, orals, I personally, in my practice, I don't have as much experience with the pellets. I just haven't had a lot of exposure to them. And I do have a hard time if someone gets a pellet inserted and then they have an adverse side effect from it. It's if it's a patch, it's easy to just peel it off and be done. So I don't have as much experience in my practice with those. But I've heard plenty of people that use them and think that they're great. And so it's kind of a very individualized thing just based on the patients.
We just had someone in our live audience talk about the pellets.
Yeah, that's right. That's right.
And tell us the difference between the synthetic and the natural hormone replacement if you're
Naturals, they do have some different herbals, like black cohosh is one that has, added estrogen to it. I've heard St. John's wort is very helpful. I think a lot of people were turning to the naturals when the medical community was shunning the hormones away. It was, well, gosh, my doc isn't prescribing this for me anymore, so let me go and seek out that estrogen benefit with the hormone, with the herbal remedies. And I think at that point in time, it was a really, really good alternative because us as the medical community were behind the times and needing to catch back up. As far as, now that we have hormones so readily available, it's not necessarily that the naturals are bad, they're just not as well tested. They don't have to go through those same rigorous standards that other medicines need to through the FDA. But do I understand why there was an entire generation of people that gravitated to them? Yeah, because the medical, clinicians weren't prescribing the other alternatives as much as we should have been during that transition period.
So a follow-up question was, for me, very young, I wasn't going through it. I was trying to be supportive and understand what my mother was going through 20, 30 years ago. I worked for Dr. Karen Pendleton here in Shreveport. She did the compounding at the time, and there weren't very many people doing that as well.
Yeah.
So how is that different from the synthetic hormones?
I mean, my mom to this day still gets her compounded progesterone and loves it.
My mom did too. She loves the compounding.
Yes. And I think if it's a pharmacist that you've worked with before and that you trust, I think I'm totally on board and supportive of that.
Do you find that it's safer per se, or is it something that people just think because they feel since it's formulated and done just for them, it's different than the synthetic ones?
I think a lot of the compounded, they're able to combine two things into one. So instead of having to, take multiple things all together, they can kind of, it's a little bit ease of access and easier to take a combo of two things together. Safety profile, I think if it's a compounded pharmacist that has, a good reputation, has a good product that and trust, I think I'd be supportive of that. Versus, I know there's also a lot of crazy things that you can order from the internet, and it's and it's compounded. It's okay, well, do we know a lot about the producer of that
And
that
even
product?
a compound, don't you need a prescription for that?
Absolutely.
I mean, how do you know what you're
Absolutely.
getting?
Absolutely. Exactly.
And it comes different ways. It still can be the cream, the topical, even I think the lollipop or some different things.
Sure.
They were doing.
Absolutely.
Okay.
Absolutely. Yes.
I just find it, anything it's food-based, it's candy, it works for me.
Yeah. And then kind of also, we are emphasizing a lot on the hormones, but I think foreplay is a big one, vaginal lubricants, pelvic floor PT, those pelvic floor physical therapists, they really can do some great work if people are having pain associated with it. Sometimes they'll use vaginal dilators if there's been a lot of narrowing and atrophy over time. different exercises, especially if there's pain, either like with insertion or deep penetration. There could be different stretches and exercises associated with pelvic floor PT.
Keep up the Kegels.
That's exactly right. That's exactly right.
So when you talk about pelvic floor PT, for people who don't really know what that is, can you tell them?
Yes. Oh goodness. So that is now a very like specialized field in the physical therapy world, where they can handle anything from round ligament pain during pregnancy to like postpartum issues to prolapse exercises to pelvic pain and endometriosis, and kind of tying into the sexual health. A lot of that can kind of help with that as well.
I was going to ask one more question because
Sure.
this rotates it. This would be my last question for her, and then go from there.
Okay.
As a physician, what are some of the myths that you've come across as far as a woman's biological and or sexual needs post-menopausal?
That's a great question. I think biggest myth is if someone does come in with sexual complaints, whether that be decreased desire, pain, low libido, etc., it's an easy myth to say, well, it's just your age. And
Absolutely. We talk about ageism all the time.
absolutely, absolutely. And I think instead of diving deeper and figuring out what the underlying cause is for why, these new onset sexual issues are happening, I think it's a terrible myth to just assume that it's based on age. And there could be many, many different, medication and non-medication treatments such as PT that can potentially help with that.
And I think a lot of ladies may not realize your gynecologist can be your overall physician.
Oh,
where you can talk
absolutely.
about everything going on
Absolutely.
with your body, not just in a particular area.
Absolutely. It's not just, okay, here's the time for my pap smear or what have you.
Yeah.
No doubt.
Well, I'm going to jump back into my original question because I'm the other P that has no sex life and would like to have one. And I would like to enter
I'm
into
throwing
that
this away.
world safely and enjoyably. So my first question is going to be, let's say you have a female out there and she's not comfortable in talking to her mate about having those challenges.
Sure.
Does she come to her physician and say, hey, I'm having challenges mentally because I don't feel really confident in that area. It may not be pain or anything just yet because I haven't explored it.
Sure.
But how do I go to my OB-GYN and say, I'm struggling mentally with even, starting to engage in that way? And what's the first thing I need to do to kind of get ready and get prepared to get back out there?
Absolutely. I love that. It's because it's hard to get back on that saddle, so to speak. And if you're not, at ease and comfortable, it'll be hard to enjoy those moments.
Absolutely.
And so I think being open and honest with both your healthcare provider and your partner, and sometimes it's just getting more creative too with foreplay, vaginal lubricants, things that, you said, well, gosh, like in my 30s, I never even thought about those things. And trying to, explore that world a little bit can certainly be helpful. And I think sexual health is super important. I think knowing the number of partners your new partner has had, or if they have any sort of high-risk sexual
I was just going to
behaviors.
ask about STIs in over 50 women, if you see that a lot.
Oh, look, I will, pretty much anyone that comes for even annual screenings, I'll make sure we have an up-to-date gonorrhea, chlamydia, trichomonas, because, that's something that can lay dormant for years and can certainly lead to pain and different issues like
symptoms,
that.
yeah.
Absolutely.
Yeah. Okay.
Absolutely. So again, kind of going into the ageism realm, like you guys said, oh, well, I don't need to order any of that stuff. It's like, no, absolutely not.
Order away, ladies.
That's right. That's
yes,
right.
we need to figure out what we enjoy, because at this age, we don't enjoy, or we may not enjoy, or can't even do the same thing we did 20 years ago.
Mm-hmm.
So you won't know what works if you don't try.
Absolutely.
Mm-hmm. So there's nothing wrong with exploratory research.
Indeed.
You may add to the standards of everything, yes, by that point. Okay, you want to wrap it up?
Well, I have one more question
Okay,
before we wrap
okay.
up. Me being someone who is on an antidepressant, I still struggle with depression sometimes. Does that medication also affect my libido and my
Yes.
Because that was one of the questions that I wanted to talk to my physician about.
Absolutely.
Okay, because I noticed her going downhill before she was supposed to go years ago. So
No, and it's a really, really good topic to bring up, and that even spans, all, regardless of menopause or not. SSRIs are a wonderful medication and super, super important, just for overall mental health and well-being. But it is an important side effect for people to be aware of, that it can cause decreased libido and decreased desire. Sometimes if it's significant enough and distressing enough, kind of similar to the fact that there's multiple different hormone formulations that we can try. There's every SSRI works differently for different people. Some people respond great to certain ones, and others say, oh gosh, no, that one really didn't work well for me, but this one was really, really good. And so I think if it's one where, okay, this has been a really big side effect change for me and it's been causing me a lot of distress, then it's kind of doing a risk-benefit analysis of, okay, well, maybe we can switch to a different one, or maybe an SNRI like Wellbutrin, for instance, or something like that, to see if it causes the same effects with regard to libido. Or if it's, well, I've tried a few different ones, this SSRI has worked by far the best for me, then it's okay, let's keep on this one, and then we'll, try to get some other things in place to help with that side effect. But it certainly is a side effect of the medication.
And I've had those conversations even with friends who are younger than me, postpartum, after they have children,
Big
and
time
trying to get
postpartum.
medications. And it's like their whole life changes.
Absolutely.
How they see themselves, how they feel about themselves, even wanting to have sex.
You're exactly
I
right.
think a woman's body is more complex than many people realize.
Absolutely.
And so many things we do, childbirth, any of that, it's going to change your hormones.
Absolutely.
Absolutely.
So would you say that's the same thing with the postpartum as the depression, figuring out those medications that would work?
Absolutely.
Or okay.
Absolutely. Actually, there's a lot of interplay between both of those, because especially in that postpartum period, your estrogen and progesterone levels, just plummet. And so depression is a big one. Like you said, you're discovering this new body. You're sleep deprived caring for a newborn. You're having to navigate postpartum blues and postpartum depression, which is a super common, diagnoses that can happen during that time period. And even during then, because your estrogen and progesterone levels plummet, so does your libido. We'll have increased vaginal dryness and pain with intercourse, especially if someone's breastfeeding, which of course we're going to advocate for. Breastfeeding is wonderful, but those are certain side effects that can happen during that time period. So actually there's a lot of interplay between the two during those stages in a woman's life. And so it's trying to navigate that as best we can. SSRIs are a great tool to help with that, no doubt about it. But it's, trying to find the right formulation, the right dose, and the right treatment for each individual. So,
What are some of the symptoms or side effects or things you may want to pay attention to when you're taking these medications and you realize something just may not be right?
sure. Do you mean side effects of hormones or?
Both the hormones and the medications that are given to us for depression, anxiety, all of those things.
Absolutely. Well, for any hormones, you especially want to check for leg pain, sudden onset chest pain, shortness of breath because of that increased risk of clots. So if you start these hormone treatments and then all of a sudden get like a sudden onset leg pain or sudden onset shortness of breath, that would be absolutely something that you would have to that you would want to go in and get evaluated for. Keeping up with all of your annual screenings, with your annual mammography, with your colonoscopies, keeping up with all of that, I think is super, super important during that time period as well. For SSRIs, during that time period when you're switching off a medication to a different one, or when you're in that initial time period, it's letting them know that when you're starting that medication, it won't reach maximum effectiveness for at least 4 weeks. And so sometimes it could be like, well, gosh, I started this and it's been 10 days and I still feel about the same. It's letting them know, okay, stick with it. We still haven't reached that maximum dose yet. But especially if the depression is severe, making sure you have all of those safety parameters in place, making sure you're not having any suicidal thoughts, making sure you're not having any at risk side effects like that. And then more general side effects would be, decreased libido. Sometimes people will say, well, gosh, like my anxiety is so much better, but my motivation to do much has really tapered down as well. And then that's when we say, okay, maybe we back up just a little bit to kind of find that steady state between the two.
Don't just take yourself off the meds, though.
That's right.
Have a conversation. Don't do like I did.
Don't do that. Don't do that. Yes.
Talk to someone else and let them taper you back.
That's exactly right. That's exactly right. Absolutely.
Well, I think you've covered a lot for us, regardless of where we are in our life, whether we're post, pre, going through no sex, some sex, one sex. I appreciate it. P, number 2, do you have any other questions?
Oh my gosh, no. This is a serious topic. It was a serious discussion. Mm-hmm. We do have a little levity sometimes in our talk, but this was a serious discussion today.
Absolutely.
So our other episodes, we'll be laughing a little bit more. But we had to talk about this.
That's right.
Caitlin, a.k.a. Dr. Busada. Thank you so much
Thank you guys so much for having me. It was fun. I enjoyed it.
Good.
Thank you guys.
Good.
I'm happy to be here. So.
Well, this has been 2 Peas, 1 Pod. And again, we thank you for coming. I've been Felecia, and this has been Bonne.
Oh, you said this has been. I was going to say a great day. Fill in the blank. Okay. Bye.
That's a wrap.
Thanks for listening to 2 Peas, 1 Pod 318, and we hope you found a little humor, some wisdom, and a lot of heart. Remember, no matter where you come from, we are all just trying to make sense of the world for us ladies over 50 living the second half of our lives. Please connect with us on Facebook, Instagram, and YouTube, and we would love to hear from you.